The reason why the chronic pain rehabilitation program is so important is because we're in the midst of an epidemic of chronic pain. Over 76 million people in the United States suffer from chronic pain. Now, when we speak about chronic pain syndrome, what we're speaking about is not only the pain that affects the various parts of your body, but it affects your memory, your ability to sleep, your ability to interact with people. So it's a very frightening experience. And typically what happens over time is you get progressively worse. Essentially, the program treats all types of non-cancer chronic pain. So if I have chronic pain of my head, my neck, my back, my shoulders, my knees, my hips, the pain typically is not just localized to that area, but it causes changes throughout my body, including my difficulty sleeping and depression and so on. So it's really geared to address all of those areas. What makes this program so effective is it's an evidence-based program. It's gone through 30 years of research and testing and clinical outcomes. And the reason it's so effective is the approach is different than a standard biomedical approach. The biomedical approach seeks to correlate some damage in your body with a symptom. In the case of chronic pain, very often the healing took place, but you're overwhelmed with chronic pain. So what happened over the years is we identified that the model has to be much broader because your genetic history, your developmental history, your culture, the way you perceive things, your experience growing up, all of these are filters which contribute to how you're going to experience your pain. The changes in your sympathetic nervous system, in other words, the way your brain and your spine and your nerves function is different. And what we have to be able to do is deal with all of those different areas. After not moving as you used to move, you begin to atrophy. 36 hours after not moving as you used to move, you begin to atrophy. So people who've sustained an injury, what happens is they develop these fears of doing movements that'll contribute to an increase in pain. It affects a total deterioration of the body. So what we do is we take what's called a biopsychosocial approach, in which we're dealing with all of the biomedical issues, the psychological issues, we deal with nutrition, we deal with your belief system, we work on retraining the way your body functions. It's a much broader approach. It's the only way to reverse a chronic pain syndrome. So the difference is rehabilitation versus management. In pain management, we seek to manage your symptoms, typically pharmaceutically, surgery, physical therapy. In the case of pain rehabilitation, the whole focus is to help restore your functioning to as close as we can to the way you were functioning earlier. I think what is unique in this situation is that Scripps is able to provide an extraordinary service which represents really the cutting edge of medicine. Scripps covers the county, provides people from really any part of the region the ability to come into a program and for the first time overcome their chronic pain.